So here we are in Victoria Falls, Zimbabwe, and reality is coming to pass right now as we have a full clinic that's ready to be finished. You'll see all the walls are up. You'll see all the walls are basically concreted right now, and now all the finishing touches need to be put on as far as the tiling goes. Electricity's already been put in, plumbing's already been put in, so now we have to do the facing. What we're hoping is that this clinic will be completely done and licensed to open by the end of January, certainly by February 1st. So come on, let's take a walk through the clinic. So basically, people from Victoria Falls are going to walk in from that gate down there, come down a paved pathway here, right here into the waiting room. And this is an open waiting room where we have circulation going through the entire waiting room. So in case somebody's sick, say with a cough and tuberculosis, it ventilates itself because all the breeze goes to the outside so nobody else gets sick. All right, now we're standing in the reception area. So there'll be a reception counter that comes all the way across here with our receptionist back here and all of our charts in the back here. And then from the area, from the reception area, people will also exit through here. And as they exit, they'll be able to pick up all of their antiretroviral therapy from the pharmacy window, which is right over here. After people check into the reception area, they'll come into this room, which will be our counseling room. So we'll know exactly what people are being referred here for. A nurse counselor will be in here, taking all the information from patients, and we'll know exactly how to treat them after they've come in here and we've taken all that information. This is a major room here where we're going to have our conference table, and people will come in here and learn all the basics about HIV, new therapies. We'll talk about patient care and everything so we can get everything consistent with the nurses and all the staff throughout the clinic. All right, as you walk in past the counseling room, now we're into the pharmacy. Very, very large room. This will be fully air conditioned. Obviously, the medications need full air conditioning. The pharmacy window so patients can pick up their meds right there. And all of this will be shelving for all the different medications and for assembling their medications into bottles to be dispensed out to all the patients here. We're now into the very important blood draw room or phlebotomy room. But we'll be drawing patients' bloods here, and very, very important, this is going to be the only clinic in Western Zimbabwe to be able to perform viral load assays, meaning determining what the level is of virus in people's bloods. If we have patients on 3-drug therapy, we want that virus to be completely suppressed to what we call undetectable levels, below the ability of the assay to detect virus. So right here, after patients get their blood drawn, we have a pass-through window here, so all the tubes of blood can be passed right through to the laboratory, which is right next door, and then patients will be able to exit right from here. We want to make sure that when patients are referred to us for their HIV and their general medical problems, that we have food available for them. It is so critical to have enough nutrition in place so that you tolerate taking your antiviral medicines, and it's important to keep muscle on. So we'll be cooking a lot of protein-based supplements here in this kitchen. All right, now we're moving into the laboratory. And this is really what makes this BAPZ clinic a specialty clinic, modeled after the Newlands clinic that is in eastern Zimbabwe around Harare. In this area here, this is going to be a very, very heavily refrigerated or air-conditioned room because we're going to have a viral load analyzer here, which will be able to evaluate at least 48 viral loads every 2 hours for the first run and every hour and 45 minutes for each run thereafter. So samples will be coming in not only from our patients, but also from Vic Falls Hospital, and other laboratory samples will be referred from other doctors around the area for analysis. And this does require a laboratory specialist to run what's called the TACMAN 48 that we'll be purchasing from Roche Diagnostics. So as we walk down the clinic, on my right here is one of the examination rooms for patients. So when a patient comes in, after they have their labs done, they'll be escorted in here. We'll have full examination equipment here, so the doctors and the nurses can do exam of patients here. And in this room on the left here, this is a very large room because this is going to be the treatment room. We'll actually have 2 beds set up here for 2 different patients at any time. We can do examinations here too, but we'll be able to do whatever the patients need. We may even be delivering babies from HIV-positive pregnant women here, because we now know for prevention of mother-to-child transmission, if we give the pregnant mother any antiretroviral medications, usually 3 at a time, before her 3rd trimester, the chances of her baby being born HIV positive are almost nil. But we will be aiming for less than 1% babies born HIV positive by giving potent antiretroviral therapies to HIV positive pregnant women. And as we come to the exit of the clinic here, over here will be the nursing office, and we'll have two very specialized nurses in here. This very large room over here is the office of Dr. David Wachi, who is our operations manager for Beat AIDS Project Zimbabwe, and he'll be stationed here along with an observation room for patients that are critically ill that may need to be transported to Victoria Falls Hospital. So right from here, they'll be transported out this exit here, and this is the exit for an ambulance to drive up on, where the patients then can be transported to Victoria Falls Hospital. So we hope to have an incredible community clinic here for all the people of Victoria Falls and for the surrounding rural villages also. Bye.